Good afternoon, and thanks again for joining us today. I do want to just give a quick update, a little bit of positive news. As of today, there was 74 new cases that was reported today, and that's the lowest we've been since mid-March on that. So a little bit of good news today. It is after a weekend, so we'll see how the week forms, but it was good news for us here at the governor's office and for the people of the state. I hope everybody had a nice weekend, was able to get outside and enjoy the weather. It was always great to have a little time for the mothers this weekend, a special time for all the mothers across the state, and we got to enjoy that a little bit ourselves, being the first weekend that was reopened across the state of Missouri. Myself and the First Lady, we were able to get out a little bit, and it felt good to be back home in southwest Missouri, doing some one-on-one interviews on Friday with the media back in the Springfield area. And I was also had the opportunity to spend a little time with the family over the weekend, so it was good to be able to do that. My granddaughter was especially pleased because they announced that her school would be having a graduation this year later in the month, so that was good news to her. Also helped the grandson find a vehicle, his first vehicle, so got to do some of the normal duties in life that it seems like I'd been absent with the family for a couple of months. So it was good to be back there and enjoy that, to do some things for people back home. And it was encouraging to see firsthand this weekend that Missourians were finding a way to adapt and safely move forward. We got to talk to several people over the weekend. We actually went out and ate one day. It was good to talk to the waitresses, the wait staff, to talk to them a little bit, how they felt about coming back and their jobs and how important it was to get back into somewhat a normal routine. So it was good to hear from the everyday people back there. On Saturday, we had our weekly call with the infectious disease and critical care doctors, and we are continued to be encouraged by trends across the state. And I just want to say how thankful I am to have that quality of expertise here in the state of Missouri, those doctors that we've been in contact with now for probably somewhere around 7 or 8 weeks. Every week we talk to them, and they take the time to be off on these calls to give us updates from their perspective all across the state, and really how they see us moving forward from this era into, quote, a norm, and then making sure we're prepared for the day comes that we all got to understand that this could happen again in the fall or next year, but how prepared are we for the state of Missouri? But it's always great to have their expertise that we get to talk to on a weekly basis. We remain confident in our recovery plan and continue to monitor the 4 pillars on a daily basis. Our healthcare systems are in good shape. PPE is getting better every day. Hospitals are reopening for elective procedures. Social distancing is working. And if wearing a face cover, be sure to follow the proper guidance. I do want to mention, there's been a lot of things in the media about whether to wear a face mask, whether not to wear a face mask, whether I should wear one, whether I shouldn't. A lot of things have been said about that. One thing I think is important, the infectious disease doctors told us on Saturday, to make sure social distancing is the number one thing you can do. So even if you wear a mask, you don't ever want to be comfortable enough to think that I don't have to abide by the social distancing. They will tell you that. So doing both is fine. But you just don't want to get relaxed and think, okay, if I'm wearing a face protection, I can get closer to somebody than what I normally would. Again, the most important thing we can do is keep the social distancing. Unintended COVID-19 effects, some of the things that we're seeing now that we've been into this situation for over a couple of months, and some of the health issues that we're seeing, even in my own family as I went through these last 60 days. My father-in-law had to be put in the hospital to have stents put in. He actually had a heart attack during this time. I had an aunt that actually had to go in the hospital to other situations. Both occasions, people were trying to put off going to the hospital simply because of the COVID-19, which ends up creating more problems. And when you think about people that need care, they need to go back and take care of that care. Now, that's opening up. The hospitals are going to be able to do that, to provide the testing, to be safer for people to go back. But we got to be able to handle all these situations. Domestic violence has increased since this time has started. That's an issue none of us want, and we got to be prepared to handle that. And just because we're dealing with COVID-19, there's multiple other things. Mental health issues we got to be able to deal with out there, that we're starting to see spikes in that. You know, child abuse reporting down. That should concern us all, and we all should be trying to understand why is that, what's creating that problem, and are people at risk out there that are just not being reported what they once were, you know. And then the increase in traffic violations. I know we talk about that and you think in those situations things would be going down, but they're actually going up. Fatalities are going up on the highways, speeding is going up, a lot of things like that. Just, again, these are all continuing things. It's almost created through the COVID-19 that's being related to that. But we got to get back to doing multiple things. We got to get back to taking care of people's personal lives and people addressing these issues that are really creating some problems for the state of Missouri. As we move through the testing part of it, testing continues to be a priority of this administration. We're making testing easier to where we're able to do more testing. We're doing the box-in outbreaks. You've heard Dr. Williams, who's here today. They'll be here to answer questions for you, how we're dealing with that, how we can do multiple different tests now that we can actually do thousands upon thousands if we need to move into an area to do that, how we're being able to test more frontline employees and first responders, how we can now do community sampling that we're doing across the state, can need to do that. Again, all of this, trying to make sure we get as much information as we can, much data as we can to be collected so we can make better decisions every day and make better decisions for the future of our state. So we continue to press forward on doing that. And again, we're getting better at that every day. You know, we're now testing patients coming into hospitals. And I think that's something I really want to encourage people, especially if you have medical conditions, you've been putting them off because of the COVID-19. I think the medical institutions across the state would tell everybody that they're prepared to start taking patients back in. And it's probably more important to go back and take care of those health care needs than it is to keep putting it off. So I think everybody's going to go in those hospitals and those clinics are going to be tested when they go in there, and I think the medical profession is going to make sure that everybody's safe when you go in there. So I want to encourage people, if you do need to be taking care of issues, please do that. Please go back and reach your doctors and try to start taking care of that. We mentioned last week that we were informed we were receiving more testing supplies from the U.S. Department of Health and Human Services. The initial shipments that were received over the weekend, we received 29,000 swabs, 11,400 viral transport media tubes that we received, and we continue to start seeing those supply chains loosen up a little bit. We're getting more supplies all the time to be able to meet the demands. We're still not where we need to be in the state of Missouri as far as having, quote, a stockpile, quote, making sure everybody has everything they're comfortable what they need, but we're going to continue to do that. PPE also continues to be a priority. I know Director Carson's here. Is going to give us a little update on that in a few minutes. I think a lot of positive things are happening in that. We're doing that. I was on the phone with Secretary Salia a little earlier that we were talking about some of the things that we're looking at in Missouri on the labor issues that they reached out today talking about Missouri, some of the things we were doing here to ask us how things were going on the unemployment side of it and how we were able to handle some of the situations we did in Missouri better than some of the other states. So we're thankful. We got Director Hugh over there and the things she's doing on the unemployment side of it. The other thing I want to just mention on the PPE supplies, one of the things that we have actually reached out to the federal government about too that we would also like to have the opportunity is actually to put businesses in place in Missouri. And I'm going to be working with Director Dixon on that and my staff to be able to, I think there's going to be an opportunity from the federal level and from the state levels for some companies to be able to expand into the PPE business where we now are starting to have those companies here in the United States. I think Missouri, being one of the first successful states of having manufacturers come into play in that, trying to take care of ourselves, could be some business opportunities down the road. So I'm excited to be having those conversations about the PPE on it. But for today, let me ask Director Carson to give us an update on PPE in the state of Missouri. Director?
Thank you, Governor Parson, and good afternoon, everyone. As Missouri moves forward with the Show Me Strong Recovery Program, I wanted to give an update on some of the issues that we've been working on with the Department of Public Safety. In the area of helping promote Missouri's recovery, as of today, the Missouri State Highway Patrol is once again offering written and skills testing for all classes of driver license in limited locations around the state. So we encourage you to check the Highway Patrol's website for the locations and the services offered, but we also encourage those who are going to the testing sites to wear face coverings and to sanitize their vehicles before the skills testing. And if you don't have a priority issue related to a driver's license, we'd ask that you wait until after Memorial Day to go and take care of that. So On the personal protective equipment front, we continue to receive and distribute PPE to our local public safety partners. And just this morning, our SEMA warehouse received 50,000 face shields, several thousand bottles of hand sanitizer from FEMA. Last week, SEMA received shipments of face shields, gowns, goggles, and gloves, and those were all purchased by the state of Missouri, along with 88,000 cloth face masks that were donated items. And then on Friday, SEMA distributed 17,800 goggles and more than 1,700 boxes of gloves and 75,000 bottles of hand sanitizer to local law enforcement and fire service agencies. I want to give an update on the alternate care site operating in Florissant, Missouri. Last week, we transitioned the staffing at the alternate care site to utilizing more SEMA personnel and relieving some of the Missouri National Guard personnel who had been there for 3 continuous weeks. There are currently 16 medical personnel from SEMA's DMAT team and 14 medical professionals from the 131st Missouri Airborne National Guard unit. The site has received total 27 admissions, and they currently have 3 patients. From a public safety perspective, there are clear signs that Missouri is transitioning back to more normal patterns. In some respects, this is positive, but there are also some downsides to this. Across the state, our MOSWIN interoperable radio traffic is rising again to more normal levels. From a low at the end of March and the beginning of April, public safety radio traffic has been up about 24% last week, but it's still down by 6% compared to the same week last year. Anyone who might have been on the roads this past weekend probably noticed that highway traffic has now picked up. Unfortunately, traffic fatalities for the year are now actually up by 6% from where they were this same date in 2019. That should not be happening when traffic on the highways is down from last year. And the reason seems very clear. When the roads were empty, some motorists drove 25, 35, or even 45 miles an hour above the posted speed limit. And from the start of the year through yesterday, Highway Patrol troopers have seen a 55% increase in the number of people driving 26 or more miles an hour over the speed limit. That is dangerous, very deadly, as we're seeing, and it cannot continue. For that reason, the patrol has moved more troopers into marked vehicles and assigned them to traffic enforcement for more visibility. These troopers came from the gaming division as the casinos were closed. But we would ask everyone to please slow down on the highways. We also need our motorists to put down their phones, to buckle up, and to remember to move over whenever first responders, emergency workers, or road crews are working on the road or the shoulder. Data the Highway Patrol is receiving and anecdotal information also show that while crime might have dropped during the coronavirus response, domestic violence cases have actually gone up. Our data is limited, but in some jurisdictions, the increase in domestic violence has been about 10%, but in Jefferson County, the sheriff reported a 43% increase last month. COVID-19 has resulted in more potential victims being isolated from their abusers, and social distancing has affected capacity at some domestic violence shelters. We would ask that everyone please remember these victims who may have seemed unseen to most of us, and we'd ask that you be proactive and you check in on your friends. Finally, this is National Police Week. It's a time we honor law enforcement officers who died in the line of duty. And in Missouri, our law enforcement memorial bears the names of 688 heroes who made the ultimate sacrifice while serving Missouri. I'd like to thank Governor Parson for lighting Capitol Dome blue on the first weekend of May, when we traditionally honor Missouri's law enforcement heroes. All who serve today find strength and inspiration in the legacy of those who paid the ultimate sacrifice for their service. I would ask that you remember them and their selfless service to our nation. Thank you.
Thank you, Director. When you was talking about the memorial years ago when I was sheriff of Polk County, one of the names on that wall was one of the deputies that worked for me when I was at the sheriff's office in Polk County, and I never dreamed I'd be able to light the blue in honor of him and all the other people that are that memorial's dedicated to over there. But it was a special thing to be part of that, and I just thank all the fallen officers for what they've done, their families for what they've went through, and really what it represents for us here in Missouri, of all of our law enforcement family every day that protect us every day. You know, the COVID-19 was one of those issues where the frontline medical personnel really drew most of the attention in the state when this happened, because the hospital's emergency room, and well just, they should have. But every day, those law enforcement officers answered the calls, no matter where they were, and when that call come in, they responded to it. So I thank them every day for what they do. I thank them for the sacrifices they have made for all of us here in this great state. As I said, we are very encouraged by the trends we're seeing across the state, and we're glad to see people re-engaging in the economy. But again, we must remember to do this safely and social distance as much as possible. Social distancing is still the most important step we can all take to protect one another and keep COVID-19 under control. This is going to be the new normal for a while. And to keep moving forward, we must continue to follow the guidelines and make smart, responsible decisions. Remember that our actions today will have an impact in weeks and months from now. We are grateful for Missourians' dedicated efforts so far, and we must keep it up throughout the recovery process. God bless, and thank you. Dr. Williams is also here today to be able to answer questions. So, Kelly, you want to start off with, how you want to start off?
I'll start with Director Carson.
Okay, Director Carson.
Any questions for Director Carson?
Hey, what is the long-term plan for the hotel in Florissant? You've got 30 personnel there, 3 patients. Is that going to wrap up soon, or do you want to keep it operating in case there's a flare-up or something like that?
The plans right now are to keep it operating for a period of time. Probably the middle part of June, we'll reassess the need and the usage there.
And what's the financial arrangement? Have you rented that, or not you, but the state and federal government rented the hotel, or purchased it, or what's?
You know, that question is best answered by the Office of Administration, but the state of Missouri has entered into a lease agreement. The details of that, I don't have the specifics, Kirk.
I'm not sure if this is for you, Director Carson, or if it's for the governor, but there was a case of COVID-19 confirmed in the Ozark Correctional Facility in Fordland. Just kind of, what do you think, is the state going to be able to handle to make sure that there isn't an outbreak there compared to like what has happened in Arkansas, where there are more than 896 inmates and staff members that have contracted the virus?
You know, Director Presythe would be the best person to answer that, but I am on frequent conference calls, and I know that the Department of Corrections is taking extreme measures to make sure their staff, as well as the inmates, are isolated when they need to be and protected all of the time.
This is also for Karsten. How is the new Battelle mask cleaning system working?
That machine is one of the, I guess it's the combined efforts of Department of Health and Senior Services, as well as SEMA and Public Safety. The Guard has been facilitating that, and I think to date there's been about 500 masks decontaminated at that facility, but we expect that to continue to increase as the awareness of it continues.
The governor mentioned, you know, we're still not where we'd like to be in terms of having a stockpile of PPE. Can you give a sense of, do we have 10 days worth, 14 days worth? How far are we from meeting that goal?
We have approximately 14 days worth of PPE. We are continuing to order and distribute as it comes in, and we look forward to the day that our warehouse is not empty. So we have made the third round of orders. I don't have all the exact numbers on what was ordered, but it's gowns and N95 masks and things such as that.
And when you say there's 14 days worth, does that mean 14 days for the needs of first responders and any excess needs from hospitals?
That is correct.
Any other questions for Director Carson?
Thank you.
Director Williams?
Hey, Kurt.
Director, is the department currently conducting any testing of any hot spots as part of your box-in strategy? And
Yeah.
where are they?
Kurt, thank you so much for asking that question because that's what I wanted to talk about. You know, when the governor mentioned 74 tests, I was thinking 7 is kind of a significant number in Missouri's COVID-19. You know, January 27th was when we started our program. Our first patient was on March 7th. Our peak for community transmission was on April 7th. We will have been at this 107 days on Wednesday since January 27th. And as the governor said, 74 cases is the lowest number we've had since the third week of March. So to answer your question specifically, Kurt, what we're doing this week is we're up in Milan right now today doing 1,500 tests of the meat packing plant there. There's not an outbreak there. We're doing that preventatively. We will be in Kansas City and Platte County this week doing another 500 tests, working with St. Luke's and Kansas City Health Department and Platte County Health Department and the state lab doing 500 tests that we have the capacity to do. And again, they're not outbreaks there at this point. It's just that they've asked us to come in and do surveillance at that. I was just in St. Louis, your area, this morning with Representative Steve Roberts, head of the Black Caucus, and a wonderful physician named Kendra Holmes from Affinia Healthcare, where we're doing 400 tests, and we're doing mobile outreach with Joe Palm, head of Minority Health. So we were at Martin Luther King and Kings Highway this morning in a parking lot doing testing, and can't thank Dr. Holmes and Allen and Affinia enough for making that. And then Tuesday, Wednesday, and Thursday of this week, we're taking that mobile testing to parking lots. I have to tell you, I was amazed how many people showed up. And I asked them, I went through the line, I said, why are you here? And it was because they were either a healthcare worker, worked in a nursing home, and they wanted to see what the result was, or they knew somebody. They'd been taking care of somebody. They were not symptomatic, but they just wanted to know. So can't thank the mayor and Fred and Affinia and Kendra and Joe and all those people enough for arranging that. So you're seeing that. And again, someone asked about prisons. You know, when the governor became governor, one of the first things he did, he wanted to see contingency plans. And I've said this before, but I'll just reiterate today, that Ann and Matt at Corrections have done a phenomenal job of planning. I mean, they have been as compulsive as you can possibly be. And I get up every morning and look all around the country and just, whether it's in Kansas or other states, Arkansas you mentioned, you know, and so we've done the boxed-in strategy down in Mississippi where we went in and checked whole wings. We did that about 2 weekends ago down in Ozark, somebody mentioned, doing that there. We're doing that through the state lab. So we are incredibly vigilant with our correction facilities and have been incredibly fortunate today that we have been able to box in those outbreaks. And I think I mentioned a week ago, I was on a conversation with Lee Norman, and they had a prison of 296 people and 75% tested positive. So those areas, meatpacking plants, long-term care facilities, correctional facilities, are very much on our mind every day. Tomorrow could be the day that we have a situation. But as the governor said, we feel like we've been very purposeful in developing our testing, that we have the resources to go in and check 500 people the next day. So thank you for the question.
Dr. Williams, can you elaborate a little bit on the testing that was done at Ozark Correction Center?
You know, I haven't caught up to that. They called me about that on Friday, so I don't know how many tests they've actually done. I can tell you at Southeast, we did 300 or 400. It's in wings. I think there are 3 or 4 wings, so we isolated the wings and did that. And also, Ann's been very compulsive about this. Before you can go back, you have to have 2 negative tests. So not only are we testing everybody, but before you can be taken out of isolation, you have to test negative twice, which probably exceeds CDC guidelines. It's one they offer, but it's very, very compulsive to do that. So we're just very thankful here in Missouri. Our efforts have been rewarded. That doesn't always happen, but so far so good.
The FDA has approved, I believe, a rapid result antibody test, and it's not the same company that you had mentioned last week. So if a better product comes on the market, could we or would we switch to that product?
I don't think so, Philip. We've got Disorin is one of 14 approved labs. You know, Bill has vetted it. He vetted all of them. As I've said before, you have to be sensitive that there are a lot of those antibody tests out there that are not sensitive or specific. So as people are spending money, you know, one thing the governor has emphasized is that when we get resources, we try to push them out. And so we did that with our Abbott machines. And so I don't anticipate that we'll change. What I do anticipate happening is that we'll develop guidelines for these counties that are, the governor got the money out to the county commissioners within 10 days. And they're now looking for ways to spend it because it has to be spent on COVID-related things. And one question I'm getting, the governor on conference calls all the time says, how would we spend this money on testing in our county? And one of those would clearly be antibody testing. So we're encouraging them to use one of the 14 labs. And you didn't ask me, but let me just, while you're here gathered, one thing we haven't mentioned today that I think is a very newsworthy is, I was on a conference call with the White House Saturday night, and tomorrow morning at 10:30 we will receive 4,000 vials of remdesivir from Gilead. They made a compassionate care dose gift to the federal government, and they've shipped it out to all 50 states. So we're in the process now of working with the Missouri Hospital Association to get remdesivir out to those patients. And I just got off the phone call with a patient and his doctor in Sedalia that we were trying to get that medicine to. What remdesivir does is it's now been approved for patients who have severe COVID-19. They can either take it for 5 days or 10 days, depending on how bad their case is. And it's been shown to significantly reduce their morbidity. And so we have enough for 4,000. We have 4,000 vials, which is about 600 patients, and we want that used. So I'll probably be on a conference call tonight with the Missouri Hospital Association trying to get that out tomorrow or Wednesday to patients who are right now on ventilators in Missouri. We don't have a lot, but we have some who could use it. So that's a big news development today.
Thank you.
Thank you.
You know, one thing before I take any questions, I know Director Carson was asked, and I'm not sure who asked it, but the stockpile of PPE. I think one thing to remember, we're probably going to be looking somewhere between a 30 and 60-day stockpile on PPE here in the state. Take a little while to get there, but I also need to remind people that the hospital also has a stockpile, quote, in-house. So I know talking to some of the doctors, some of the hospitals has a 14-day supply now, so you add the 14-day we have, so then you're out there that 28, 30-day window a little bit there. So I think it's important to remember that that's both happening on the local level plus the state level to be able to do that. But again, we'll be working with them. But the one thing I want to stress again, we're going to be much more prepared down the road for this situation, and we're going to be dependent on some Missouri companies before this is over to help us bridge this gap so we don't get caught dependent on foreign countries like we were the first time. So with that, questions?
Just asking again, just your thoughts on the Ozark Correctional Facility in Fordland, and are you confident that there won't be an outbreak like there was in the prison in Arkansas?
You know what? You never know where the outbreaks are going to be, how much they're going to be, but I'm going to tell you, Director Presite, early on, again, we were prepared in this state. We knew that those prisons were very high-risk areas. Her and her team established a procedure early on, instigated that, and as you see today, we've been very fortunate in this state. That could change. It's a virus. None of us have control over that. But I'm proud of what the director's done for our state and our correction institution, how many people we have in there and how many people they're managing. But they have got a good program in place of how they can quarantine in a very quick fashion where they can isolate people and take care of people, and they've done that already, so we know that model works. So again, you know, they've done a great job, and they'll continue to do that. I think we're prepared. We're much better prepared than what some of the other states were around us for that issue.
The House and Senate have passed the budget, so they conceivably could just quit right now. But what if you told them to that your priorities are in the next 5 days?
You know what? I haven't told them anything about priorities. I mean, they come in here. The one thing that I thought was important to do was to get the budget process. Anything we could do that could help our businesses across the state, COVID-19 related. I think there's some things like that we talked to them early about. But as far as the legislation going back and forth, we've not been engaged in that, other than we just kind of trying to keep pace with what all's going on there. I mean, there's a lot of things happening right now. But the reality of it is the governor's office, our priority right now is close to 400,000 people on unemployment, trying to get the economy to going back, trying to make sure we get people back to work, how those jobs are, how are we going to be able to help with training when that day comes, how do we end up with the COVID-19, how do we finish fighting this virus. So all of those things are a priority right now, and they continue to be our priority in this office. But again, some of the things I said earlier, some of the other things we got to deal with that you have to deal with every day, plus you got to get the economy, trying to figure out how you kickstart the economy to get it back going and put people back to work, because it just compound problems if you don't do that. So, whatever the legislators do, they do. When we get those bills finally, as I've said before, I don't know what bills will make it across the finish line, what won't. And we'll just see what that happens. And I don't know what they'll look like when they get to my desk, whether they get signed or not.
Well, would you suggest that they do go home and not gather in the House chamber as they are doing?
No, they've got a job to do. It's not my job to tell them when to go home. That's up to them. They're all elected officials, and they're doing their job. They're doing hopefully what people sent them up here to do, and that's what we should be focused on right now. Again, I think the priorities of all of us right now should be trying to take care of the people in this state. And I think the priorities should be, how do you get people back to work? How do we create the jobs that we've lost out there? How do we bring businesses here? And how do we fight COVID-19? Those really, for right now, are the priorities. And what are we going to do later on this year, months down the road? And we'll deal with the budget numbers as the budget numbers come in.
If Wayfair is not passed this week, would that by itself be worth calling a special session?
I don't know about special sessions at this point. I really don't. The first priority is going to be is what's the federal government going to do? Still going back to the coronavirus, what are they going to do there? Or are they going to take any actions? I mean, right now we've got Plan A, Plan B that we're trying to work from the governor's office, but I don't think there's any. The possibilities of the federal government doing something between now and June, I'm going to, guess like anybody else would have is maybe 50-50 chance of something happening. But I'm sure going to be planning if it doesn't happen, and I'll be planning if it does happen. But right now, that's the priorities of what we're trying to figure out is how we're going to make things go. Look, it's tough times here in Missouri, but nothing we can't overcome if we can get people back to work and we get the economy going. But the longer that stays stagnant, just more problems it creates. All right, thanks everybody for being in here today, and we'll be back tomorrow. Thank you. And tomorrow I think we're going to be talking, Director Dixon is in tomorrow. Kelly, is that right? We're going to be talking about economic development, some of the things that are going on there, so hopefully we'll give you a few updates there. I do think we'll know a little bit more about it tomorrow, but I think there is some businesses looking to expand in the state of Missouri to create some jobs and some new investments here in the state. So as much as it is a troublesome time right now, it's also an opportunity for a lot of people. So hopefully we're going to try to take advantage of that and get people back to work. So again, thank you all for being here today. Thank you.